Spread that pussy wide, let me go for a dive.
This video is not just inappropriate, it's deeply disturbing. You are taking an invasive medical procedure and pairing it with explicit sexual language and music. Then you frame it around a Gen Z patient. Gen Z includes minors. So what exactly are you implying here? In healthcare, the provider holds the power. They have the knowledge, the authority, and the access over the patient's body. A Foley catheter insertion is an intimate, invasive procedure. So when we have a doctor that turns it into sexual content, it's not a freaking joke. You are somebody in position of power. This is a moment where the patient has the least amount of power. This is you exploiting your power imbalance. And then Gen Z includes teenagers and minors. So when you combine this sexual tone in an intimate procedure and that generation, that creates a deeply disturbing implication, whether it's intentional or not. Healthcare providers are supposed to create a safe environment, especially for our younger patients. Anything that even hints at a sexual reference is not acceptable. Women already feel unheard. A lot of patients already walk into a clinical setting or a hospital with the fear of being dismissed, exposed, or not being respected. You are reinforcing the idea that women's bodies are not treated with dignity and their experiences are not being taken seriously. And for patients with a history of trauma or sexual trauma, this is triggering. It's not harmless, it's not funny, and this is how trust in healthcare gets damaged. Patients deserve to feel safe, especially in their most vulnerable moments. And anything that threatens patient safety needs to be called out. Healthcare is not a place for sexually suggestive content, ever. This needs to be addressed and he needs to be held accountable.